First of all, thank you for being here for one of the most historic and significant votes in the history of this board and East Jefferson General Hospital. The issue before us is whether East Jefferson General Hospital should recommend to the Parish Council a sale of our hospital to LCMC Health, the parent company of Children's Hospital. Before we cast our votes, I think it's important for us to answer several questions about this proposed transaction. How we got here, why we chose LCMC Health, and why it matters for the future of EJ and healthcare in our community. The original concept of the community hospital grew out of the recognition by civic leaders in the 1960s that the East Bank was growing at a rapid rate with a population that justified an investment in healthcare. A bond issue was approved by the voters in 1965, and ground was broken shortly thereafter. Jefferson Parish voters approved a one-mil tax in 1971 to support the hospital. That tax expired in 1980. We have not received any additional monetary support from the parish subsequently. This facility was opened on January 14, 1971, with 250 physicians and 250 beds. This week, East Jefferson Hospital will begin its 50th year of operation. Proudly, we do so now with 785 physicians and 2,400 team members caring for the needs of our patients with a record of outstanding health care that is the envy of our competitors. Our mission as a community hospital is focused on providing the highest quality, compassionate health care to the people we serve, with special care through innovation and collaboration with our team members, medical staff, volunteers, auxiliary, and our East Jefferson Foundation. I joined East Jefferson as a much younger physician in 1985 during the boom years of the East Bank growth as the hospital became an iconic landmark for the community. The hospital grew with the community, meeting challenges, expanding and innovating to be competitive with the best in healthcare regionally and nationally. The mission then and now is that our physicians and team members are dedicated to excellence in healthcare and the best overall patient experience. Our high level of care has been validated over and over again by professional organizations and accrediting bodies rating our services against national and state standards. One example of this type of recurring award-winning recognition is our Nurse Magnet Hospital designation, earned for providing excellent patient care and a superior environment for our nurses. In 2002, EJ became Louisiana's first Nurse Magnet hospital, and we are the only Louisiana hospital to earn the designation 4 times. Another example is that we are the only CMS 4-star hospital in Orleans or Jefferson Parish. With this kind of record, you might ask, why is it necessary for us to do anything? Why do we need to seek an affiliation with a larger healthcare system? The discussion about joining a larger system has been under consideration for more than 10 years. As early as 2008, the board began exploring options to maintain the viability of East Jefferson General Hospital. Prior to our current negotiations with LCMC Health, it is well known that we negotiated several possible affiliations with HCA over a period of years. Those efforts were unsuccessful ultimately, but they were a great learning experience, providing us with a perspective on how a better outcome might be achieved. Over the years, the demographics of our patients have changed and created more complexities in treatment and reimbursement for our services. East Jefferson General Hospital is not economically sustainable as a standalone facility in the current healthcare environment. We are actually operating currently under a forbearance agreement with our bondholders. That agreement allows for 2 options. Number 1, partner with LCMC Health, or number 2, face bankruptcy. For our own survival, we must consider the option of this sale to guarantee our future. Fortunately, our discussions with LCMC Health have shaped an operating structure for EJ that will allow us to sustain our outstanding healthcare record through the enhanced ability of a larger system to share resources that will take us well into the future. We wanted and found a partner dedicated to maintaining EJ as a prominent community hospital. Established in 2009, LCMC Health is a Louisiana-based, not-for-profit hospital system created by Children's Hospital of New Orleans, and it services the needs of the Gulf Coast region with more than 2,200 physicians and 9,000 total employees. LCMC Health currently includes Children's Hospital, Touro, New Orleans East Hospital, University Medical Center New Orleans, and West Jefferson Medical Center. As part of LCMC Health, they all deliver high-quality health care with the ability to focus on clinical excellence education, technology, and research. This partnership between East Jefferson and LCMC Health is also important to our region as it ensures competition in the marketplace, which is healthy and sharpens everyone's ability to deliver higher quality services. People in Jefferson Parish deserve multiple healthcare options, and LCMC Health, with its current portfolio plus East Jefferson, will maintain those options. It is likely, in fact, almost guaranteed, that our competitors will oppose this proposed sale in order to increase options for patient choice and reduce competition. Under this agreement, East Jefferson General Hospital will retain its name. Patients will continue to see their trusted physicians and staff who manage their care. For most patients who visit the campus regularly, they will see very little change in their relationship with our team members and especially our physicians. Our ability, though, to deliver more efficient service through enhancements in equipment, facilities, and technology will be greatly improved. Together, LCMC Health and EJ will protect and preserve the positive impact of high-quality, not-for-profit care in our community. As mentioned before, we searched for some time for the right partner, and we are confident this affiliation is best for the community, team members, medical staff, and most of all, for patients to receive the care they need. LCMC Health's Board of Trustees unanimously approved the proposed partnership recently. Under its proposal, LCMC Health will assume specified obligations, property, equipment, and our employees while providing operating capital and a commitment to future investment. This transaction will enable EJ to secure the pension benefits for all East Jefferson General Hospital retirees, defease the bonds, and cover all known obligations. East Jefferson General Hospital will be joining a healthcare system with a vision to put the patient first and a mission to deliver care with heart across its entire health system. LCMC Health has more than 2,500 active volunteers, which is a great compliment to our 250 active volunteers who donate more than 90,000 hours each year.